Thank you. So I like to call this talk Busting the Big Myth of Healthcare. And I like to come up with new neologisms to talk about our screwy health insurance and healthcare systems. And I like to tell a story. Many of you may have heard this before, and I apologize if so, but it's funny every time I tell it. I laugh. I was at a concert a few years ago, and this is after I'd started my practice, and the lady next to me said, "Well, what do you do for a living?" And of course, everybody in the room knows what a conversation starter is when you say, "I'm a doctor." And so she said, "Oh, well, what kind of doctor are you?" And I said, "Well, I have my own practice, but I don't take health insurance." And she looked at me and she said, "Wow, that's genius. You're a genius." And before I said, "You should talk to my ex-wife," I was like, "Well, I don't really consider my business model to be genius. I think of it like being sort of like every other business in the U.S. I mean, I provide a service and you pay me for it. So what's genius about that?" But let me tell you what is genius, lady. What's genius is the fact that you think I'm a genius. Now that is what's genius. And that is the big myth of healthcare that I want to talk about how to bust today. And this talk really revolves around what we're calling these days DPC. Anybody not know what that is? Everybody doesn't know what that is because you're all calling it direct primary care. And I would like to submit that it's direct patient care. And actually, I would like to submit that this is a misnomer. This is a really crazy idea that we have to label it as such. It's sad that we have to call this direct patient care to set it apart from the genius healthcare system that exists now, where we rely on health insurance to pay for all our health care. And as I'm going to show you, that's just nuts. So I love seeing patients. They just hate paying me for it. They want to use their health insurance. I've got a couple of cute little stories. I opened a clinic 5 years ago. I'm an emergency physician by training, but most of what we do in the emergency room is primary care, basically, and so I opened a primary care clinic 5 years ago. Sadly, I had to close it. I'll be forthcoming and tell you full disclosure, I had to close it at the beginning of this month because the lease renewal was just outrageous, and I'm taking donations for that. I'm going to start a GoFundMe page. It seems to work for everybody these days, but the bottom line is I kept all my patients, all but 4 of them stayed with me. I've got 120 patients. And I'm doing house calls for them now. I've already done a couple of house calls, and it's working great. And they love it, and they contact me anytime. I've already answered a couple of issues today. So full disclosure is I don't have my clinic anymore. But the patients, when I had my clinic, a couple of cute stories that really did happen, by the way. One day, a lady came in, and my clerk said to her, "Gosh, that's a nice purse you got there. What kind of purse is that? Do you mind if I ask where you got it?" And the woman said, "Well, yeah, sure. It's a XYZ brand, and I got it for only $400 on sale. But do you take Aetna? I need a flu shot." And I mean, the absurdity of that just really struck me when I heard the story. Then another story that's even better or worse, however you want to look at it, was when a gentleman came in one day for a sore throat or some routine thing, and I was doing urgent care at the time. I wasn't doing a concierge or a retainer-based practice. And he said to the clerk, he said, "Well, you expect me to pay $99 to be seen, and you don't even take my health insurance? I'm just going to go to the ER." And the clerk said, "Well, sir, your ER copay is $250. And he said, "Oh, yeah? Well, at least they take my health insurance." And I was like, "I'll see you next time, buddy." So this is what I call the big myth of healthcare. And what the big myth of healthcare is, if I could define it in a simple term, it's the belief that we need health insurance to pay for all our healthcare. And I mean all of our healthcare. Now, I hope everybody in this room realizes that is just not true whatsoever. So why do Americans believe this, though? Well, it's pushed into their faces every single news day, every election cycle, every time they turn on the TV or whatever, they hear about the rising costs of healthcare. The rising costs of healthcare. This is such fake news. This is the biggest fake news story going, I would submit, and it's been perpetrated for decades on people. And it's made them believe in health insurance to the point where we've achieved now the United States of health insurance, with Obamacare in 2010 coming around that mandated everybody has to buy health insurance or face a fine. I mean, I would love to have a product for sale that the federal government said, "You all got to buy it." I mean, I would love to have that. But we don't, and thank goodness that's being picked apart one piece at a time by the Trump administration. Anybody that says Trump is a bad guy, maybe you're right. Vote for him in 2020, please. The big myth of healthcare is preached by politicians, pundits, and the press. I call them the high priests of the big myth of healthcare because every day across the news cycle, you hear healthcare being equated with health insurance. And I like to create memes. I'm on Twitter. I have a good following on Twitter. I'd like to make people laugh. And one of my memes is that one does not simply say healthcare when one is really talking about health insurance. Likewise, this guy, anybody not recognize this clown? I love how they say, how these Democrats, politicians especially, like to say that if this plan passes, 23 million people will have their health care ripped out from them. Well, you know, 23 million people are going to probably decide they don't like tartar sauce next year, too, but that's okay. But they're not getting their health care ripped out from under them. We're talking about health insurance. Now, the big myth of healthcare is a part of what I like to call also healthcareonomics. And I have a blog called healthcareonomics.com. I have a Twitter and a Facebook page, Healthcareonomics. I encourage you to follow me there. But my definition of healthcareonomics is simple. It's the study of how normal economic forces get twisted, warped, and broken when applied to the American healthcare system. Like, for instance, you will never see this happening. When somebody says, the mechanic says it's $600 for a tune-up and an oil change, and the would-be customer says, do you know how much I pay for my car insurance? I can't possibly pay you, too. This never happens within the car insurance world. This doesn't happen within the homeowners insurance world. But I've seen it happen within healthcare, and this is one of the challenges that we face. Anybody in here doing DPC? Dipping your toes in the water? All right. So you may know what I'm talking about, a little bit of this. You've had conversations with people, and they've said, you know, I pay $1,700 a month for my health insurance plan to get my $20 copays. And I like to look at them and go, there's an answer there somewhere. Now, let me say this. I believe in health insurance. I advocate that people do have health insurance. I'm not a kook. I'm not out here saying, get rid of your health insurance and go naked. I'm not saying that, but I'm saying that if you're looking to health insurance to provide with all your health care needs, high deductibles are the game changer, and those days are over. So it's time to get out of that box and start thinking separately. Unfortunately, there's not a whole lot of options out there just yet, but stick around. There's going to be soon. Another thing I like to say is, thanks for your $1,800 a month health insurance premium. We got your $100 doctor visits covered. Or another way of saying this that I like to point out is that how do you turn a $100 doctor visit into a $20 copay? You buy an $1,800 a month health insurance plan. All right, so I'll give you my best attempt at the Carl accent right here. And I've literally pulled this on patients too and made them laugh and say, how much you pay for your health insurance to cover your flu shot? Mm-hmm. And I mean, that's what people look at. It's gotten to the ridiculous, too. I created something I call Dr. W's equation, and it's a simple way of comparing health insurance plans. When you're shopping for health insurance, you want to find out what the best deal is, people tend to go based upon a combination of what can we afford versus what gives us the best coverage. Well, how do you determine what the best coverage is? They look at the deductible. Some of them look at copays. In my first book, I tell a story about a patient that came in and he told me that he didn't want to come see me as to be his primary care doc because I didn't take his health insurance. And I asked him, I said, do you know what your deductible is? And he goes, yeah, $20. And I was like, that's your copay, man. Do you know what your deductible is? He had no idea. So it's $5,000 his deductible. But even that is a misnomer. Even that is misleading. If you base it upon the deductible, so if you look here at these deductibles, this is straight off of healthcare.gov, by the way. $5,500, $3,000, zero. That gold plan, the United Healthcare Gold Compass Balance Plan, has a $0 deductible. Now, you just can't find this kind of great health insurance anymore, can you? Yes, you can, because look at the out-of-pocket maximum. It goes from $6,500 to $6,850. You actually go up on your out-of-pocket maximum. In other words, your out-of-pocket responsibilities for that $0 deductible that you're paying more for go up. So my equation is very simple. It's P plus O equals W. That's the annual premium plus your out-of-pocket maximum equals what you might spend on health care and health insurance in any given year. When you look at these numbers, in my first book, I do 10 analyses. This is one of them. And in all 10 cases, the bronze plan turns out to be the best, the most financially advantageous. Now, that's not always the case. The one case that I can clearly point out is that if you're taking the outrageously priced drugs, you need better prescription drug coverage. You probably want to go for the silver or gold plan. But every year on my blog, I do, in the summertime, it's coming up, I do an analysis of the Texas teachers. Anybody in this room, would you pay $3,200 more in premiums to knock $1,500 off your deductible? Let me rephrase that. Would you put $3,200 in a slot machine that might pay you back $1,500 if you win? No, nobody would. In 2015, though, almost 46,000 Texas teachers and ISD employees did just that by upgrading to the gold plans out of a combination of fear of the rising cost of healthcare.
Were they a math teacher?
I don't know how many of them were math teachers, but I asked that question in my blog post. It's shocking.
They may have been forced to.
I don't think so. I've talked with several of these folks. I talked with some coaches and principals, even a superintendent or two, and they were all like dumbstruck. When I explained the math to them, they were like, what? One guy, a superintendent of a local school district, they came into this ER where I was working. His wife had cancer. She had breast cancer. She's 42, unfortunate. And they bought the gold plan because she's got cancer. And I was like, you just wasted about $6,000. And they were shocked. They were absolutely shocked. Well, they didn't waste $6,000 because she was breast cancer. She was probably taking the high-priced chemo drugs. But nevertheless, absent that, they're wasting money. So in any case, most health insurance is sold this way, the analyses that I've done anyway. And this is where people it's a combination of fear and ignorance and confusion. And the confusion rests with, have you ever looked at your benefit plan and you look at all these different variables they're throwing out there? It would have made Einstein pull his hair out trying to keep track of all these variables. And yet they sell health insurance this way, and they sell it big time, believe me. So, as we all hopefully know in this room, it's not the costs of healthcare that are outrageous, it's the charges. When aspirins cost $12 in the hospital setting, they don't really cost $12. They're charged at $12, but aspirins are sub-cents as far as the cost of these things go. It's the markup that gets ridiculous. But that gets lost in the language of the big myth of healthcare that's being put out there all the time by the press, by the politicians, by the media. I've discovered one thing, too, and I want to say this, is that I think the media is in on the scam. Because I have several radio show and TV producers who follow me on Twitter, and I've reached out to a lot of these folks, and I've tried to say, hey, can I get on your show? Can I get on, Hannity, for instance, and say, hey, listen, I'd like to talk about the wacky world of healthcare-onomics. Nothing. They will not have me on their show to talk about that stuff. Makes me think that there's a little bit of synergy going on between these big media corporations and the news. In fact, one well-known radio show host, his producer and I instant messaged each other on Facebook one time late last year about how, and I won't mention the producer's or the radio show's host's name, but believe me, he's listened to by millions, and it ain't Hannity. But I talked to the producer about being on the show, and they said, nope, the last guy we had on to talk about this, it was a fill-in for the actual star. The star was listening, and the fill-in started talking about healthcare and all the screwiness in healthcare, and the star of the show called back to the program and said, 86 that, do not talk about that. So you think that one through and tell me what you think. So another thing about cost versus charges, and this is a real conversation that occurred too between myself and not a patient, but an HR rep from a company I was trying to talk some sense. I was trying to do business with, and I explained to her that if an ultrasound, my patients get ultrasounds for $150 cash, or you can go blow $800, $1,000, $1,200 on an ultrasound if you try and use your health insurance to pay for it. And her response was, I swear to you, she said, well, I think I'd rather pay the $1,200 and get credit toward my deductible. I was like, I don't know what to say to you. Not in this setting anyway. If I were really going to say something to you, you wouldn't like it. So why am I talking to you about this? For those who are already involved in a DPC, a direct patient care type practice scenario, you're going to need some help. You're going to need to think this through. And in Atlanta, I had an interesting conversation with a woman who came up to me. I don't think she's here today. And she was Chinese, and she works in New York City. And she came up to me after I'd given my talk, and she asked me all about how she can get out there. She works with the Medicare population. She does house calls already for the Medicare population. That's her practice primarily. And she wants to do DPC. She wants to get away from Medicare. And I looked at her deadpan, and I said, now, I think you speak Chinese, right? And she goes, oh, yeah, I speak Mandarin. I said, of course, Mandarin is what I meant. I was joking her. Do you know how many Chinese people there are in New York City? Do you know how many Mandarin speakers there are in New York City? You should market yourself. Do you have a website? Oh, no, I don't have a website. Have you tried marketing? No, I don't know what you're talking about. Well, let me explain something. When you do DPC, that means you get out of the greatest marketing tool that's out there currently for physicians, and that's the provider directories, the PPO network directories, the HMO network directories, where people just look you up. They make an appointment. Oh, they can't get in. It's May, but they can't get in until August. That must mean you're really good. They'll wait the turn. So the bottom line is this is advertising. This is one of the only, maybe the only benefit I could see of being involved in a health insurance relationship is you get free advertising through them, but it costs you a lot in other ways, I'll bet. So if you're going to open or you're trying to practice DPC today, you need to look at marketing. The famous thing is location, location, location. It's all about marketing, and it's all about sales, sales, sales. Because if you don't do it, you're going to fail. Because this is a very tough message you're trying to get across to would-be patients. You're not selling widgets. People will spend $400 on a purse. They'll look at you if you want to charge them $99 for a visit, and they'll look at you like you need to be on medication. So you've got to get the message across, and the message is very simple, and it is this. With high deductibles, that is the game changer, folks. That's what's changed in healthcare. How did health insurance take over healthcare? They did it by taking over the patients. How are we going to take healthcare back? All of us in this room and thousands more like us could get together, and we could collectively sigh. And not much is going to happen. What we've got to do is educate the patients. We've got to take it back one patient at a time. Have a hashtag on Twitter, every new patient is a win. And that's true because the more you convince, the more you get to tell their neighbors, their friends, their church families, everybody around them, their neighborhoods, their communities, we're going to win. We're going to take healthcare back. This is why I've told all 5 of my kids, you should be a doctor if you want to. I mean, because I think the future is very bright for us. And thanks to high deductibles, that's going to be possible. But in order to do that, you have to be slick. McDonald's. Anybody not know McDonald's? Anybody not recognize McDonald's from 10 miles away down the freeway? Of course not. Why? Because they're constantly in your face. Even McDonald's, as recognizable, as well-known, as ubiquitous as it is, they spend millions of dollars a year on advertising. How many folks in this room spend any money on advertising? Not many. Well, if you're going to do DPC, you better get used to doing that. Because if you don't advertise, if you don't get your word out there, you're going to be overlooked. You're not going to make it. Because in this day and age, you've got to act like every other business in the U.S. if you want to make it as a DPC doctor. You've got to set yourselves apart. And guess what? It's relatively easy these days because there's 3 things missing from healthcare: affordability, customer service, and consumer choice. And I want to show you a little commercial that I did. Unfortunately, I ran out of money before I could post this to TV, but I put it on the internet and it got some hits. This is a few pounds ago, by the way. There's 3 things missing from healthcare today: affordability, consumer choice, and customer service. I'm Dr. Kevin Wacasey, and here at the Colleyville Medical Clinic, you can get all 3. Feeling tired or gaining weight? Well, you can get a thyroid screen for only $25. And for you ladies, you can get an ovarian cancer screening for only $35. Want to get your heart checked out? An EKG here is only $25. And customer service? Well, if you have a scheduled appointment and I'm not at your side within 15 minutes, your visit is free, guaranteed. Our prices are not only affordable, they're upfront too. And you can find them all at colleyvillemed.com. So the next time you're sick, or if you just want to stay well, come visit us at the Colleyville Medical Clinic. It's about time. So this is a commercial I did, had a lot of fun doing it. It took me all day, that little thing at the back or at the very end where I used to play baseball, so I'm excellent at catching things. You'd be amazed. That took like a dozen takes to get that right. But anyway, the bottom line is that commercial got me approximately 0 new patients because I put it online and it was viewed thousands of times on Facebook and it's been viewed a few hundred times on YouTube. But, you know, I'm not a very good marketer. I mean, that's not my strong point. They offer college degrees in that stuff. So marketing is extremely important. Sales is extremely important. And none of us in this room are really good marketers and salespeople, I would wager. Actually, I'm a very good salesperson. I'm a good closer. I'm like a baseball pitcher. I close the deal. I'm not good at starting them. So the bottom line is that if you're not good at this, and we're not, you need to hire people that are. And it's a worthwhile investment. So The other piece of advice I would give you is that if you're going to hire somebody in these fields, these are full of some of the flakiest people, short of politics, I've ever seen. And so you got to check references, you got to look at results, you have to be ready to spend some serious money to get real results done. I hired a publicist out of Dallas, a well-known guy, used to be a reporter there locally, and he's connected with all kinds of things. And he got me, one Friday morning, I was on the radio in 10 different Fox News outlets across the country. I had to wake up at 6 a.m. I live in Fort Worth, and I had to be on in Connecticut, and I was on in San Diego, and I was talking about the dangers of mixing Red Bull with vodka. Now, I wanted to talk about my books. I wanted to talk about healthcareonomics. I wanted to talk about how people are being screwed on health insurance. Instead, all he could get me was nonsense, talking about the latest trends in constipation management. I'm not interested in that. So, again, the media is not your friend in this regard, not yet. But marketing and sales are extremely important to putting a DPC practice out there. Why? Because these are the guys we're up against. This is the big four, or some of the big five, I should say, and they have spent years perfecting this. Don't underestimate the genius of the health insurance industry. They created the big myth of healthcare. They promulgate it still. They profit from it handsomely, as I'm about to show you too, and they know what they're doing. I was talking with another friend of mine on the way down today, and I said that if Soviet central planners and communists could plan out their 5-year and their long-range plans as well as the health insurance industry has been able to do for decades, oh man, we'd all be speaking Russian now. The communism would have been a smashing success. But unfortunately, fortunately for us, they couldn't. But let me say, the health insurance industry knows the psychology of consumers. They know. Anybody take a guess how health insurance took over healthcare, what the linchpin was?
World War II.
Well, that's when health insurance took off, but what was the nail in the coffin of the lid of the physician-patient relationship? It happened in the 70s, I'll give you a hint. It's what brought managed care in.
Managed care. HMOs.
$5 copays. The $5 copay was how they did it. They turned everybody into zombies. They turned your $30 doctor visit into a $5 copay. Good luck. Okay, they're going to go see her. They're not going to come see you with your $30. You can offer them $25. Get $5 over here. So that's how they did it. Well, that's still going on. People still believe in copays, but those high deductibles and even worse, the high out-of-pocket maximums change that equation forever for us. We need to take advantage of it. In fact, the health insurance industry, this is a fun fact for you. In 2013, they took in $744 billion in health insurance premiums. That was 5 years ago, okay? I don't know what it is now. But the interesting statistic here is that of that $744 billion, 2/3 of that money, or almost $500 billion, that's a trillion with a trillion, by the way, almost $500 billion went to just 25 companies. And I like to point out on my Twitter thing occasionally, and I love it when the business geeks come after me and they're like, that's not profit, that's not, the crude value and stuff. I'm like, I don't care. I got it off Wikipedia, but I take the corporate snapshots off Wikipedia. And in 2016, McDonald's, that I already talked about, did about $26 billion worth of business and revenue. Anybody guess what Aetna did? Go back to that slide. Anybody guess what Aetna did in 2016? $66 billion. Microsoft did $67 billion in 2016. Anybody want to guess what United Healthcare did? $187 billion. And this is for something that used to be sold door to door. I mean, this is awesome. The health insurance racket is huge. And they've got these clowns in their pockets too, okay? We told them all that the deductibles are gonna go down, and wait, it'll lower their premiums too. I mean, these clowns are laughing all the way to the bank, even the Republicans. So I say we need to don't stop replacing incumbents in 2018 because they've been bought off, they've sold their souls to the health insurance lobby, and that's going nowhere fast. That's why the president's having to issue executive orders to counteract what they're doing. I have a hashtag on Twitter based upon this famous Journey song. I like to say, I would sing it, but it'll run y'all all off. I like to say, don't stop repealing. We need to don't stop repealing all these laws that protect and prop up this unholy and ungodly health insurance industry that we have. Again, I'm all for health insurance, but it's gotten way out of control. We need to rein it in. In fact, I have another video here that many of you might find interesting. This is the one piece of the Michael Moore movie, Sicko, that I found not only factual, but worth repeating. And it's pretty good if you'll watch. This is President Nixon from 1971.
You know, I'm not too keen on anything saying that. This is a private enterprise one. Well, that's good. Edgar Kaiser is running a permanente deal for profit. And the reason he can do it, I had Edgar Kaiser come in and talk to me about this, and I went into it in some depth. All of the incentives are toward less medical care, because the less care they give them, the more money they make.
Did everybody get that? That was Nixon discussing Edgar Kaiser's visit of Kaiser Permanente fame, talking about the advent of HMOs. This is literally the day before President Nixon signed an act allowing HMOs into existence. And in my first book, The Guide to Buying Health Insurance and Healthcare, I go over the history of HMOs in depth and talk about how they're illegal. I mean, they violate so many. They restrict our trade. They restrain our trade. Would everybody agree with me? They restrict the patient's choice. There's no other industry that I can think of where this kind of skullduggery is allowed by the federal government. So they break all kinds of other laws that exist throughout our other aspects of our lives and other industries. And Nixon talks it over with Ehrlichman. And did everybody catch what he said? That the trend is toward less medical care. In other words, the less medical care they give them, the more money they make. And President Nixon said, fine. So it's awesome. I mean, so we're outgunned from the beginning. We've been outgunned since I was a kid. So this is another slide that I like to put out there, and basically this is my ultimate education tool for patients, is that if you have a $12,000 deductible, your $20 copay is stupid. So forget copays, forget deductibles even. If you have a high deductible, you know, you're paying for your health care. Congratulations, you're a consumer now. I'm not talking to you, I'm talking to patients. And we got to educate these folks. We have to make them understand that they're paying for their health care anyway. Dr. Croft, I was talking with, he's a neurologist. I'd write a story in my book about a neurologist around the corner from me, not Dr. Croft, and who a few years ago from my clinic, I wanted to refer this gentleman, a patient, and I called his office, and I got, I think I got the receptionist on the phone, and I wanted to speak to the physician. And the receptionist, I asked, I said, do you do cash pricing? And the receptionist said, I'm sorry, let me get you the office manager. I was like, okay. And so the office manager gets on the phone with me, and she's like, can I help you? And I said, yeah, I wanted to know if you do cash pricing. She goes, we don't accept cash. I was like, well, you should, because let me explain what's going on with these deductible things. A couple of weeks later, I got a nice lunch out of the neurologist who came around and sees it my way, and now he's doing the cash thing. And I mean, this is a threat. I understand you have to be under the radar on this for some things regarding, you know, managed care contracts, et cetera, and depending on your employment status. But cash is king. Cash, you know, cash is legal tender. You can use it for all debts, public and private. So, I mean, if you want to pay cash, check or credit card, come see me. If you want to pay with your insurance, go see somebody else. And I think that's the attitude that we need to adopt as much as we can. I know it's not going to be easy for many people, especially specialists. Believe me, I know it's not easy. I tried it, and I've almost failed with regard to my clinic. But it's going to be doable. As time marches on, you watch. This will become the new norm within healthcare, and we need to take advantage of it, and we need to get that cat out of the bag as quickly as possible. I want to close with one of the quotes out of my second book, Healthcareonomics. It's a collection of 500 of these funnyisms. And you wouldn't let a health insurance company pick what goes on your pizza tonight. So why do you let them pick which doctor you get to see? And by pointing out the absurdity of the healthcare system, of our big myth of healthcare, by pointing out the absurdity with which general Americans, the everyday Americans, view themselves and view their role within the health insurance industry, once they get it, and they really do. So I would encourage each and every one of you to, of course, buy my books, read my blog, follow me on Twitter, but also, if you can, please, start educating your folks, start educating your patients, start preparing for the day when you're going to take cash, when you're going to convert your practice and hopefully get out from under this health insurance nightmare. Thank you very much. Any questions, or is it time for questions, Jeremy, or we're going to do that later?
Yes.
Yes, ma'am.
So another trend, kind of going another step, Scott and White, Baylor Scott and White down in, at least in Bryan College Station, they have some plans that not only does the patient have to pay their $700 to $1,200, then it just went up from $700 to $1,200 a month.
Premiums.
Premiums.
Yay.
But then their $6,000 or $7,000 deductible has to be paid in full before any services are covered.
Oh my God.
Well,
That way at Anderson, MD Anderson,
so
just for anybody going in.
can I tell you what that is without being too smarmy? That's insurance. What we had for 50 years, 60 years was not insurance. It was prepaid health care. And I love it because I get into these little squabbles often on Twitter with doctors even who say, we have a prepaid health care system. And I'm like, no, what we used to have was a prepaid health care system. Now we have insurance, which is something you hardly ever get to use. And if you think that was a mistake, that was absolutely, I'm telling you, the health insurance industry are genius. And if I may make a very crude analogy, they're like drug dealers. Once they got everybody addicted to their product, and I hope you understand, everybody's addicted to this. I got you. Once they got everybody addicted, they could charge whatever they wanted to. This is why health insurance premiums now rival mortgage payments for many people. But once you got everybody addicted, if you're a really smart drug or dope dealer, you can make even more money by adulterating the dope, by cutting it, by putting, sugar or flour in your cocaine or whatever, and make 1 kilogram into 2 or 3 kilograms. The addicts are still going to buy it. They're going to grumble. They're not happy, but they're going to buy it because they're addicted to it. Anybody got an idea how they did that with health insurance, how they diluted their product? Marty mentioned it. High deductibles. They make you pay for the majority of your health care, even though you're paying them thousands of dollars a year. And the beauty of it is, if you use my equation and look at some of these insurance plans, you can spend thousands of dollars a year on the health insurance that you now almost never get to use, or you can spend thousands more to get the illusion of having better coverage. It is genius. They're absolutely genius, and they're absolutely evil. And I was asked one day, what motivates you? What's your motivation? I was like, revenge. And my friend said, revenge against who? Who's the unlucky side? And I was like, the health insurance industry. Because they've crushed my colleagues' careers for decades, and they have impacted patients' lives mercilessly. And they're evil. And they need to be taken down. Sorry, before I get militant. Yes, sir.
I don't think what we have now is, I wouldn't call it insurance, because insurance is all about risk, and they've taken the risk totally out of it, especially with Obamacare, with the fact that they can't turn anybody away. People according to their medical history.
Sure.
Whatever happened to, I can remember when I started private practice in 1984 in the Valley, which is the poorest county in probably the United States. So I had half of my pediatric practice Medicaid, the other half was mostly self-paid. I remember the people that had insurance, we would give them a sheet that said the diagnosis and how much they paid me for my visit. You go get insurance.
They filed it.
I don't work for your insurance.
That's right.
That went away. They called it indemnity insurance.
Right, exactly.
Whatever happened? What made that go away?
Well, I have a theory. If I may expound to Jeremy, you're going to have to pinch me to get me to stop talking. But I have a theory, okay? And it is this. And I talk about this at length in my book. I'm not going to give the whole book away. But the bottom line is, after World War II, health insurance came along. Before that, there was no such thing as health insurance. There was sickness insurance that covered your wages if you got injured or hurt on the job. But otherwise, there was no such thing as health insurance. So employers started offering this as perks. Well, it was perfect for the health insurance industry because they could sell this rather than going door to door. They could sell it to thousands of people. But I think they realized from the beginning that people will insure their cars. People will insure their homes. They will insure silly things like pets that have value to them. How many of your people are non-compliant? How many of your patients are non-compliant? How many patients don't give a fig about their health until they're feeling bad enough? And I like to say that when somebody feels bad enough, they won't pay me $1,000 for the year to have me on call 24/7 for them. But when they feel bad enough, they will come in and spend thousands of dollars and let me stick a needle in their eyeball if they feel bad enough. So people, when it comes to their health, they have to be kicked into doing something, especially when it comes to buying health insurance. So I think that the health insurance industry, I like to say, and I say this in the book, that if they hadn't gotten married to employment back in the 50s and by the 70s, it would have been a fringe product. And we probably wouldn't have needed it because the healthcare prices would have kept pace with inflation. But that's how they did it. They took over healthcare to keep themselves in business. And my, what a job they've done. But what I do know, and I'm not saying it's going to be a pretty process either. I mean, it can get pretty ugly. But yeah, the transition. Well, let me say this. The transition needs to occur. And the more people that start jumping on this bandwagon and saying, I'm not using my health insurance. I want the $300 MRI. I don't want the $3,500 thing. I want the $300 thing. And I'm not even going to show you my health insurance card. When we get enough patients doing that by the thousands, and it's probably going to take millions, that's when you'll see real response happen. Like I said, though, the neurologist around the corner from me, he changed his practice with one phone call when I shamed him enough. So, I mean, I think that, it's a slow process, but, pretty soon, I mean, a tonsillectomy is always going to be a big ticket item because it's a risky procedure. It involves a lot. But, I don't know what the Surgery Center of Oklahoma does those for. I don't know what the healthcare blue book value is on that either. And I'm not saying that you should pay cash. I mean, you're insured and stuff like that. But, what we're going to ultimately come to, I hope, is a system where health insurance does what insurance is supposed to do. And this is why I say it may not be insurance because of the risk mitigation, that kind of thing, but it acts like insurance in that nowadays you hardly ever get to use it. Now, there's another thing happening with association health plans that a Trump executive order is fashioning up, whereby it's going to take those to a national level so that like-minded groups of individuals. I remember seeing Rand Paul on TV over a year ago and saying that if like-minded individuals want to get together and form their own risk pools, they ought to. And I was like, what? They can't? Repeal that law next. Don't stop repealing. And Trump did it with his executive order. The regs have still to come out on it. That's going to be another probably 90. They've given themselves a 90-day extension as of 2 weeks ago. But once this comes out, this is going to likely shake a lot of stuff up because these small groups of barbers, realtors, people like that who haven't been able to get into these big group plans, they're now going to be able to form association health plans. And it's a whole new animal, and I think it's going to be very beneficial for folks. I think we're out of time, but thank you very much for your attention. I appreciate it.